Hi everyone. We're excited to be here today to go a little further in depth about tobacco-free living and the effects it has on cancer and cancer outcomes. So I will get us started. First, we will briefly discuss, what is tobacco? It sounds like a silly question, but it is a plant, a very large plant that contains a lot of chemicals, over 4,000 different types of chemicals. One of those chemicals that everyone is very familiar with is nicotine. Nicotine is found when the tobacco leaves are dried. And this is what triggers the release of dopamine in the brain, which causes the addictive cycle to kind of begin. As we all know, nicotine is the part of the plant that is highly addictive. And there are, a lot of different ways that tobacco can be ingested, which we will talk about next. There are two different ways in which tobacco can be used, smoking and smokeless. As you can see, smoking is kind of the more familiar ones, I would say. Cigars, cigarettes, vape, pipes, and hookah. And then smokeless, chewing tobacco, snuff, snus, and then the pouches. And one important thing I wanted to kind of talk about with the vapes is this is a little bit different because it's inhaling a liquid rather than burning tobacco. There's a lot of misconceptions that vaping is safer, which, it is not. The particles that you inhale cause inflammation in your lungs, which can cause, permanent damage to your lungs. It can also affect your heart and your brain. So that is one thing we like to make sure that's clear.
So let's talk about some of the risks associated with smoking. When we think about certain cancers, certainly a lot of us think of lung cancer that has that correlation with tobacco use. But when we look at this list here, we can see that tobacco use and smoking does have a few other cancers with associations, and that includes head and neck cancers, leukemias, stomach cancer, kidney, pancreas, colon cancer, as well as bladder cancer and cervical cancer. Smoking has been linked to about a third of all cancer deaths in the United States. So nearly 5,000 Americans die each year just from smoking-related causes. And so that also can include some of our chronic diseases that also are associated with tobacco and smoking use. And some of those can include strokes, blindness, gum infections, heart disease, aortic rupture is a possibility with tobacco use, pneumonia, hardening of the arteries, chronic lung disease, including asthma, COPD, decreased fertility, and then also increased risk of fractures, particularly hip fractures. So on average, non-smokers live about 10 years longer than smokers do. And approximately 40 million Americans smoke cigarettes, and more than 16 million are currently living with one of these smoking-related diseases. So we just like to point out that tobacco use is really one of the largest preventable causes of disease and premature death in the world, because right now it's estimated that tobacco use can kill more than 7 million people each year around the world. So when we talk about the impact of being tobacco free, some people think, well, I've been smoking for years, why change now? And so we like to point out some of these things that can happen once we quit smoking. Within 20 minutes after that last cigarette, your heart rate is going to start dropping. About 12 hours after, the carbon monoxide levels in your blood will return to normal. So that's a very quick, fast adjustment that we can see. Within 2 weeks to 3 months, your risk for having a heart attack or a heart-related event will start to go down. Your lung function will start to improve. 1 year after quitting, the risk of having coronary heart disease is already cut in half of what a smoker, someone who is currently smoking, will have. 10 years after quitting, that risk of lung cancer death has already dropped down to half of what someone who may continue smoking. So we see a lot of definite benefits with stopping smoking.
All right, next we will discuss the benefits of quitting. We have noticed, or there's been, a lot of research done, and there are better responses to treatment. This is specifically talking about the cancer population and oncology population. Better response to treatments, whether it be chemo or immunotherapy, less side effects from treatments, faster overall recovery, more energy, less fatigue, which we know is a huge problem while patients undergo treatment, and then an easier time breathing. Just some facts as well. Patients with cancer who have never smoked or are former smokers or have recently quit smoking have an approximately twofold increase in the 5-year overall likelihood of survival from cancer. There was a small study done that included 112 small cell lung cancer patients and divided them into 3 different groups. Patients who had quit smoking prior to diagnosis, those who stopped at diagnosis, and then those who continued to smoke. And the results found that, excuse me, those who had quit prior to the diagnosis had the best overall survival based upon the 3 groups. Next, we will discuss the actual link between tobacco and cancer and the effects. So when someone smokes tobacco or uses tobacco, the overall cancer treatments are less effective. There are increases for complications, increases the risk of recurrence, increases the risk for secondary cancers. And then, we like to just remind that quitting even after diagnosis can improve survival. Just relating back to the study that I had just talked about. So the tobacco smoke contains carcinogens. The smoke is actually the thing that damages the important gene cells. Some of these gene cells normally keep cell growth under control, while others push the cells to grow too fast if they're altered. So if someone is smoking, these genes are altered, it causes the cells to grow out of control, which then, leads to cancer. The actual tobacco smoke and its components can promote the progression and metastasis of cancer, markedly reduce the effectiveness of treatments, and increased smoking has been correlated with overall poor response to very common therapeutic modalities, whether that be radiation, chemoradiation, immunotherapy, or surgery.
So we're going to break down just a little bit of how smoking can affect each of these common cancer-related treatments that some patients may get through their journey. So the first is related to chemotherapy and immunotherapy. And so one of the things is that the tobacco and smokers have been found that they metabolize the drugs faster. And so what that means is the drug is broken down and the medication is cleared from your body at a much higher rate than normal. And so when we're talking about getting these medications for treatment, we worry that the treatment won't be as effective, and then also concern of more toxic effects from that. And we also notice that smoking increases inflammation, and then a lot of patients will have associated disease such as COPD, and that can be hard because they'll notice, again, these side effects such as the heart and lung problems, weight loss, fatigue, increased risk for infection. So those are some of those things that we worry about as it relates to the chemotherapy. Another option for treatment is radiation. We know that radiation can be very beneficial for the oncology population, as it can certainly cure or shrink very early stage cancer, helps prevent recurrence of disease. It can relieve symptoms or palliation in advanced cases, and also can be used to treat recurrent cancers. And some of the things that we worry about when it comes to radiation is that studies have shown that when patients continue to use tobacco products while undergoing radiation, they can actually have increased radiation toxicities, and then also increased risk of recurrent disease at that site. So if someone was, say, like getting a head or neck, they might have increased pain or increased mouth sores as they are going through the treatment with their tobacco use. Other side effects that some patients will notice is also increased weight loss, loss of taste, fatigue. Their voices may change, and they also may have some issues as far as bone and soft tissue problems. And some of the reasons this is thought to be a factor is that smoking can affect our oxygen levels. So when we smoke, that causes hypoxia, or a lower amount of oxygen in the body. And so the hypoxia is thought to produce those poor outcomes with the radiation. It also can have an effect on those natural killer cells in our body. So people who have less of those natural killer cells are at an increased risk of having, problems with their immune system that does help with, a lot of the chemo and immunotherapy and radiation response in our body. Okay, and the last one is surgery. So we know that surgery is an option for patients as well in some cases. And so certainly the earlier we quit before surgery, the better outcomes that we have. We know that patients, if they're able to quit at least 4 weeks before surgery, they're able to have, better lung capacity to handle the surgery, since those oxygen levels are able to, better tolerate surgical interventions. If we're able to quit about 3 months before surgery, we know that overall recovery time is improved. And then at least 3 weeks before will improve our ability to heal and our decrease wound infections, just because we know that tobacco use can certainly make it harder for our bodies to heal from surgery, affect our immune system. So all of these things that we talked about for some of the other slides also come in play here when we're talking about surgical interventions as well.
All right, this is just another graph that we found helpful to kind of, show the other risks that come with smoking and those who undergo any surgery for cancer treatment. Smokers are 40% more likely to die on the in the OR or within 30 days of the surgery versus non-smokers. As Lisa pointed out, quitting even within 2 months of the surgery can significantly reduce the complications. So as you can see, overall, the percentages of complications in smokers versus non-smokers is a lot higher. Those include heart attack, stroke, wound complications, like we previously stated, your heart suddenly stopping, shock, and needing to be on a ventilator. All right, so how can we help at LCI? Whether it be, you're starting the journey of tobacco cessation or you've kind of dabbled with it in the past, but we are here to help. And here are some ways in which we are available. So we have free virtual classes. I'm not sure how often they meet, but they are very helpful. You can register at the email address below, or you can call the phone number. You can ask your provider for referral to actually speak one-on-one with someone in our tobacco cessation clinic. We have specialty trained providers such as Lisa and myself, who work one-on-one with patients to discuss behavioral modifications and as well as medications. There's also acupuncture that is available. There's been some research studies that have shown that acupuncture alongside of one-on-one counseling has been proven to be effective for tobacco cessation. We also have an NC and South Carolina quit line. They have 24/7 assistance. They can also assist with medication finances if patients aren't able to afford the medications. You can either call the quit line, you can text them, or you can ask your team to put a fax or referral. And they are available to, for counseling. I've had patients tell me that they will text them reminders during the day or just texts of encouragement. But you can choose how much you want them to be involved or, not involved at all. To dig a little further into our specific clinic, it consists of trained nurses and providers. We assist with, like I said before, pharmacologic methods, as well as non-pharmacologic methods, motivational interviewing to kind of assess for barriers to see, what we've tried in the past, what has worked, what hasn't worked. We are, kind of like your cheerleaders. We provide hope and not fear. Slip-ups are okay. We always try to, remind patients that we are human. We reassure them it's not easy, but the more you try, the more successful you will be. The most effective approach to tobacco cessation is, twofolded. It's the behavioral modification and the medication. And this is so important because, as we've all drilled in your head, tobacco use and smoking is the leading cause of preventable disease and death in the U.S. So, your health is very important to us.
So a brief overview of the medications that we recommend with the tobacco cessation clinic. And so just to kind of point out that these medications are used to help the physical dependence on the nicotine itself. And that's where, some of our patients they won't be smoking anymore, but they will be using things like the vape pens. And that's where we're trying to focus on is helping that addiction to the nicotine, which is what is found in the tobacco products. So Typically, when you meet with one of our providers, we will establish a quit date with you. A lot of people will have a certain goal, whether that be, before they start treatment or, before somebody, like a family member, big event, whatever that quit date is, we will kind of set that. And we like to try to start the medications before that quit date so that we work towards that quit date. A lot of the medications we recommend using for at least 12 weeks and up to 6 months, depending on which medications that we use. Some are a little bit more long acting and some are short acting. So we do use things such as Chantix. And, a lot of patients come into our clinic with a lot of stories related to certain medications. And then we do try to just kind of talk over those fears, right? Sometimes one medicine may work really well for one person, may not be the best for somebody else. And we review your medical history to make sure that we are picking the right medication for you. Some of the things with the Chantix is that, a lot of times people will say it causes a lot of nausea or GI upset. And we find that if you take it with food and water, that has helped that process. So we'll have patients who are able to stick to it because we're able to guide them through. Another medicine is Wellbutrin that can be considered. And then otherwise, we also do recommend things like the nicotine patches and then the additional use of the lozenges or the gums to help with those cravings. And then, as Caitlin mentioned, the behavioral modification is also a very important part of what we do. And so we really help, we kind of guide into kind of some of those barriers are and how we can help overcome those risks of relapse, right? So a lot of times it's figuring out when the patient tends to smoke or to feel that need for smoking. Some patients, this is when they're driving or with their coffee in the morning. And so really trying to work with people to figure out new techniques they can do throughout the daytime so that they're not, relying on those cigarettes, because we know that any cigarette use, once we've quit, even just a puff, does increase our likelihood of that full relapse. So we really want to continue to provide these behavioral modifications, try to help patients tobacco proof their house or car if possible. If they have family members who are also smoking, it does work best if they're able to quit alongside them, just because if you have one person in the home that is smoking, that will increase that risk for them to, get back to that smoking as well. Also, other things, helping with stress management, because we know that sometimes stress can be a driver that will leave people to try to, pick a cigarette up. So if we're working on other ways of stress management, that can be really, really helpful as well. And then we know that alcohol can be associated with increased use of tobacco products. And as Caitlin mentioned before, we also really just try to dive in that the slip-ups are normal and can be part of this process. And, the more times that someone tries to quit, the more likely they will be successful. And so that's why we are here to continue to encourage and help people through the process.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.